Hi there and welcome. It is good to have you with me today. I would just like to invite you, if you are watching this on the replay or on YouTube when we've got it posted there, to take a moment to like the video, drop a comment, share it with a friend, subscribe to the channel, do all those good things. They help to increase the visibility of these recordings for other people, and it's just good for my channel, and I really appreciate your help with that. Thanks so much. I would love it if you would take a moment and just say hello in the chat box. I like my mini classes to be very interactive, and I want to make sure you can find that chat box and can drop a comment there, because I'm going to be asking for interaction as we go through, just to make sure you're still paying attention. Make sure you're still awake, that I haven't put you to sleep. All right, so find that chat box and say hi. And it's good to see some familiar names here. And it's good to see some names that seem to be new to me. So welcome, welcome. And if you're new, don't be shy. Don't be shy. We're friendly. We don't bite. And just while we've got those messages coming in, so good, so good. Thank you for that. Encourage you to grab a pen and a paper. Make sure you've got your water or your herb tea handy to be, sitting on that while we're going through. Because what we're going to be doing today is we're going to be looking at sclerology. And specifically, we are going to be looking at sclerology combined a little bit with iridology to help us find ways to assess our clients' health more quickly and effectively, so that we can create protocols for them more quickly and effectively. Because, for many of us, we are working with clients. How many of you work with clients now on any level, whether you're a registered nurse or a nutritionist or a herbalist? Let me just have you put the word client in that chat box if you're working with clients now, if you actually have an active practice, because this is important stuff. Many of you do. This is so good, so good. Yes, excellent. When you're with your client, you need to be able to work quickly and efficiently and effectively, right? They don't want to wait for results to come in. They don't want to wait while you think about things. They want answers now. They're primed and they're ready. That's why they booked the appointment. They want your help now. And so the better job you do of assessing and then creating a protocol for them while they're with you in that first appointment, the more likely you will retain them for the longer term. Making them wait 3 or 4 weeks to come back while you think about things, while you gather information, or even wait a week, you'll lose a lot of people that way. We also need to be aware, lots of holistic practitioners can run things like IgG tests and IgE tests. These, again, have a high rate of false positives and even some false negatives. And so if you can take those kinds of test results and back them up against the backdrop of sclerology, iridology, symptomatology, it'll help you to interpret those results more effectively as well. And of course, we just want to be able to provide our clients with the most effective information right out of the starting blocks, right? That's what we want for them. This is what one of my course graduates said. She said, "What a fantastic course with a fantastic teacher that actually cares about your success. I'm happy that I found her. I'm a registered dental hygienist and have been for 20 years, but I've been studying naturopathic and homeopathic modalities on the side to help my own family. Now I want to open my own business using iridology to help others be healthier. I've already signed up with Judith for her next class so I can brush up on the body systems and learn herbology along with it." So thankful to Angela for posting those kind words on the IPA site for me. Now, in truth, and you've probably figured this out already, I do these free mini classes. I do just about one every week to introduce you to iridology and, in today's case, sclerology. Or if you've already got a foundation in the eye sciences, then hopefully these mini classes expand your understanding of that, because we're using the latest research. We're using the latest information here. And iridology has developed so much in the last 20 or 30 years. Boy, it's way different from when I first learned it 40 years ago. So as we do this, I'm going to share some sclerology with you. We're going to look at some cases. I'm also going to share with you information about the upcoming course. So hopefully that will be of interest to you. Both iridology and sclerology are assessment tools. They are not diagnostic tools, right? In diagnosis, we name a disease. In assessment, we're looking at all of the pieces to understand what's going on, what the pathway is for this problem, where it started, why it's where it is now, and how we can interrupt this pathway. The iris shows us genetic potentials, so where the genetic strengths and weaknesses are, so things that have been passed down from the last 3 or 4 generations. And that can show us which organs want to have problems on their own and which ones want to negatively impact another organ as well. Now, the sclera, however, shows us where the body is struggling now. It shows us where the nurture points or the hot spots, whatever you want to call them, are right now. So when we know where we've got problems and we understand the genetics behind the problem, it gives us more insight. So it might sound like the sclera can give us enough information with which to create a program, but the sclera doesn't do that. It doesn't help us understand the pathway of the problem. It simply shows us where problems are and a little bit about what kinds of problems they might be. We really need the iris to help us understand why these problems are there. We also need to know some health history. We need to know diet and lifestyle. We also want to make sure that we have at least 2 or more indicators teaching us about a potential problem, because each indicator that we see adds a layer of depth to our understanding, right? It's very much like using a GPS. If you only are picking up one satellite with your GPS, you're not going to be accurate at all. If you're picking up 2 satellites that are pinging to you, you're going to be a little more accurate, but there's still a lot of leeway for problems. We need 3 GPS satellites in order to triangulate accurately where we are and what direction we're going. The same with iridology. We want at least 2, but preferably 3 markers giving us information about any particular situation before we run with it. And certainly we'll take more than a mini class like today to teach you everything you need to know about sclerology, but we're going to actually touch on 3 different markers, and we're going to do some real life application to help you understand a little bit more about how this would work in a clinical setting. When we dovetail iridology for the genetic potentials and the sclerology for the where the issues are right now, and combine that again with the client's symptoms, we get a very clear picture of what to work on and in what order. So here's the thing. Iridology and sclerology are both learnable skills. But I think you'll agree with me, and I want to know in the chat box if you do or not, that the truth about learning any skill is the more practice, the more feedback, and the more mentoring you get, the faster you get good at using it. Do you agree with that? If you agree with that, that practice, feedback, and mentoring are important to learning a skill well and quickly, give me give me feedback in the chat box. Just give me the word feedback. Yeah. Thanks for that, Kathy. Yeah. So important. And Carol Ann says feedback too. This is so good. The same is absolutely true with iridology and sclerology. With the best training, you'll understand how to integrate what you already know about nutrition or herbology or aromatherapy to get the best results for your clients. So I want to know, what is your background? Do you have herbology? Do you have nutrition? Do you have aromatherapy? What are the modalities you use that you want to integrate with iridology? Just drop that in the chat box for me. It'll help me to do a little bit more of a on the fly kind of tweaking of this mini class to meet your needs better. And I'm asking for that because that's exactly what I do in the dynamic iridology course. Is I teach iridology and sclerology, but I also teach you how to integrate it with what you already know. And it takes us studying hundreds of cases together and giving feedback and teaching the markers and the process of iridology to help you develop your confidence as an iridologist. This is so good. We've got a reflexologist who's also a personal trainer and an RN. Go, Kathy. Sophia is a biodynamic craniosacral practitioner. Excellent. Caroline is an RN and naturopath. Ooh, welcome, Caroline. So good. So good. We're going to make this fit for you. So are you ready to look at some eyes? If you are, give me a yes in the comments. Yes. Because that's where we're headed. Fantastic. All right. So here we have a lymphatic iris. So that means it's a blue eye. When we do an assessment, we look at the iris, the pupil, and the sclera because they each give us a different kind of information. We have to understand how that information all works together. How does it dovetail? How does what we see in one part of the eye modify our understanding because we see something in another part of the eye? These things all work together. So remember, the iris is primarily inherent. It's what's been passed down through the generations. The pupils also give us some unique information as well, some of which is inherent and some of which is dynamic, and we don't have time to dive into that today, but we do cover that in the dynamic iridology course. Today, we're going to focus on the sclera because the sclera is dynamic. It changes pretty quickly sometimes, and you know this. If you've ever had an ugly cry and your eyes have become bloodshot almost immediately, and then you dashed off to the washroom and you splashed cool water on your face and you calmed yourself and you waited for a few minutes and that bloodshotedness settled, right? So we know that the blood vessels in the sclera respond very quickly to many different things. But what about when blood vessels are there when we haven't had an ugly cry? They are telling us the story of what this body is doing now. In the Dynamic Iridology Assessment System program, we will learn 12 of the most common and important sclera markers. We'll learn what they teach us about the client's current health challenges and how to assess them in conjunction with iris markers. Today, again, we're only going to focus on about 3 of these markers because we don't have all day. So depending on your computer monitor, you may or may not be able to see this, or your device screen. Can you see that there is a tinge of yellow in this sclera? If you can see that tinge of yellow, give me the word yellow in the chat box. It's not a big, bold light or a bright yellow, but it is yellow. Excellent. Good. So you are seeing this. That is brilliant. Fantastic. The medical world calls this jaundice. That is the correct term for this. And again, depending on your device, it may or may not be really obvious, but if you can see a bit of it, that's good. When the sclera is yellow, it suggests, and most of you have some kind of a medical or a good anatomy background, so I'm just going to use the proper terms here. When the sclera is yellow, it suggests that bilirubin is not being conjugated properly. And this is an indication of a liver enzyme imbalance that can be a part of a bigger problem, right? When someone's eyes are jaundiced, you know that you've got to be thinking about liver. If you see jaundice, you need to ask questions to find out what the client knows about their liver health. Sometimes they know a lot, sometimes they know nothing. Have they been diagnosed with something that could cause this symptom? Is it a benign situation that you could support with nutrition, herbs, or lifestyle, or is it potentially more serious? We need to know these things because if it's something that's been diagnosed and it's very serious, then we can do support, but we're probably going to, in some ways, default to the medical world for this client. Understanding, having that college level anatomy and physiology is so important because we need to understand what bilirubin is. We need to understand where it comes from. We need to understand why the liver enzymes could be out of balance. And then with whatever further training you've got in naturopathy or herbology or nutrition or whatever other things you do, you can begin to integrate things there. Now, in this iris, you will see that right here at about the 40-minute mark, we have an iris fiber that's doing a funny little jaunt, right? It takes almost a right turn and then almost another right turn. That is in a liver reaction field. That alone, this is iridology, not sclerology for this part, just so you're not getting confused. That is telling us that this gentleman, this elderly gentleman, is genetically predisposed to something with his liver. What? We don't know. We just know something. When we see that we've got yellow in the sclera, plus this little fiber here that's not radiating straight out, it it warrants the conversation with this client about his liver. And again, it's not that we can diagnose why jaundice exists, but at least we need to understand his health history and his current diet and lifestyle. So the story behind this particular image is this is an older fellow. He's in his late 60s. He has never been an alcohol drinker. He takes supplements. He's not on any medications. He has worked a lot in environments that were chemically toxic. He's worked with a lot of at-risk kind of chemicals in his lifetime. Now, that won't change his iris. That's not what made this fiber this way. This is how his parents made him to have this fiber that jogs around here. But that exposure to chemicals can certainly stress the liver. Right? One of the liver's 650 jobs is to neutralize toxins so that we can excrete them properly. So when we see the yellow in the whites of his eyes like this, it suggests to us that that his liver's not happy, that something's gone amiss. And Sophia is saying, is that the right eye? When we look at our pupil here, this is actually a left eye. This is a left eye. Okay. And so we are using a constitutional map to ascertain that this is a liver zone. So if his concern was that he'd noticed his eyeballs becoming yellow, we can give dietary advice and suggest that he spend some time in the sunshine because that can help the liver to conjugate the bilirubin better. We might suggest that he might want to talk to his doctors if he hasn't already about this and get some labs done so that we can understand what's out of whack and see what we can do to help him holistically. And is it something that we're going to need to mesh with a medical approach with his doctors? But at least just even seeing that we've got the jaundice going on here, we know that we can begin with some liver support. So until he gets medical tests back, we need to encourage him to drink enough purified water every day. Again, we need to encourage him to get some good sunshine every day. We need to make sure he gets enough sleep. Sleep is really important for helping the liver to keep caught up on its bilirubin work. And really important that he not skip meals. Right. And if you've got your A&P under your belt, you'll know that those are key things that are always recommended in a situation where there's jaundice. Now, you'll notice that we've also got some gray clouding here. Now, that's another sclera sign that we might want to chat with him about, as there are many potential causes for that. But there's one that's really, really predominant. We're not going to dive into that one today. Okay, so with this one, now we're looking at a blue iris of a 70-year-old farmer. He's lean and he's fit. He looks very, very healthy. He has a small farm. It's a hobby farm. It's not like a great, big, massive operation. And he does most of the work on his own by hand. He doesn't have tons of great big machines doing all the feeding of the animals and everything. So he's throwing bales and he's mucking out stalls and he's feeding the livestock, and so he's staying very busy physically and doing a lot of heavy lifting, which is excellent. So I asked him what he would like my help with. Now, he came to me. I met him through a service organization, and he was on my mailing list from there. And so when I got my new Iridology camera, I sent out a request asking for anyone who wanted iris photos and a 30-minute mini session just so I could get their photos to use for teaching. I asked them to reach out to me, and he did. He was curious about iridology and about what it could tell him. He didn't have any known health issues. So I simply looked at his irides for inherent indicators and his sclera for dynamic indicators to guide my questioning and investigation. I also checked out his pupil size and shape because that, again, those two things give us a lot of information. What I noticed primarily is that in his sclera, he has a lot of meanders. So meanders are these vessels that look like they're really twisty and turny, and they look like a river or a creek running through farmland, right? Really windy and twisty and turny. So when I see these, they get me thinking in a particular direction. And they're going to give us information about an organ, but also about an overall something that's going on. So we had a conversation about his health history. his diet, and his lifestyle. We need the background for the context, because while many indicators have their own meaning, again, they also modify each other. And the more we know about the client, the more we can understand what these different markers are telling us. And getting to know our clients and get that information from them means that we can give them personalized information. If we don't have that health history, their diet, their lifestyle, that basic background information, then we can only give them cookie cutter answers. Just a cookie cutter analysis that everyone who's got this mark has this problem. And that's a very stilted way to work with this. So I asked him tons of questions. And what his sclerae show me is that in spite of his apparent robust health, he's got a lot of circulatory system markers in general. These meanders generally mean congested circulation. Congested circulation. And when we locate them on a sclera map, we know which organ likely is suffering with that congested circulation. So as we were talking, and because I knew him from this service organization, I knew that his chapter of the service organization, they're heavy drinkers. They do a lot of good in the world. They are also very heavy drinkers. And so it's rare that he goes through a day without 3 or 4 or 5 alcoholic drinks, alcohol-based drinks every day, right? So I needed to think this through, because if the meander suggests circulatory congestion, what would cause that? Could it be that the blood vessels just simply are too tight and constricted? Could it be that there was maybe a plaque building up in the arteries? Could there be other things going on as well? So because of his alcohol consumption, if he was to become a regular client of mine, I would have wanted to see some labs from his doctors, because his iris suggests that there are some inherent risks with his cardiovascular, lipids, and triglycerides. So when we see this, we're thinking triglycerides, cholesterol. We're also thinking blood sugar imbalances of various kinds. And so I would want answers about what's going on in his blood chemistry right now to understand more why this is happening. Why is this building up? And that's going to help me get to the root of that. Does that make sense? That if I get his history, and if I look at his iris and at his sclera, I can begin to get a feel for the direction that I need to be going. If that makes sense, give me a makes sense in the comments box. Sophia says, yes, thank you for that. I appreciate that. So while we're waiting for him to get test results done, and where I live, that could take a month. Sometimes it takes 3 weeks to get your doctor's appointment and another 2 or 3 weeks to get an appointment at the lab. It can take a while. And that's time a-wasting, folks. And so we can talk about this and we can say, well, we know the circulatory system is congesting in lots of ways. He's got lots of these meanders that are different thicknesses spread throughout his eye. We've got this that is suggesting cholesterol, triglycerides, or blood sugars, or all three. So we could make some recommendations here. So if you had a client where you suggested, where you were thinking that you were looking at cholesterol, triglycerides, blood sugars, and that that there was maybe some congestion in the circulatory system, what would be maybe 2 specific dietary things that you would suggest to them? Or what would be 2 specific herbal or vitamin things you would suggest to them? I want to see your thought processes here. What would be a couple of things that you would suggest? And let you type that in really quickly here. Cut out the sugar. Yeah, that's so good. Garlic and omega-3, brilliant recommendations for supplements. Yeah, very nice. Very nice. What else do we have? What else would you want to see here? Sophia, I would expand the cut out the sugar to cut out the alcohol, right? But I know because of his social group, he's not going to cut out the alcohol. Digestive enzymes and lecithin, good recommendations. Ginkgo could be another one. Get that circulation going, especially to the brain. Excellent. Excellent. I love this. This is so good. So those would have been some of the things that I would have suggested, just the other thing that I would have suggested, knowing that he was not going to, Kathy, you nailed it, that he would not quit the alcohol because that's his social life. He's not married and his wife has died. He's got this farm. He's got all these buddies from this service group. And when they get together, they just simply drink. They do good stuff, but then they drink. And so he's not going to cut that out. But I wanted him to add the green leafy vegetables. Absolutely. I wanted the leafy greens there to be supporting the liver. Maybe he would eat leafy greens for the rest of his life, but maybe he doesn't want to take a supplement for the rest of his life. Suggestions of hydrochloric acid and protein, more proteinous diet, excellent recommendations, enzymes for the blood, fantastic. And that's how we start the thought process. Now, notice that through all of this, I've not said he has a disease. I've not named anything. I've said the irides show an inherent risk. The sclerae show us something is brewing. How do those dovetail together with his diet and his lifestyle? And that's how we arrive at our answers. How's that feeling to you? Is that feeling good? Or do you have some questions about it? Let's see some things in the chat box while we're continuing on. This is a woman in her late 30s. She came in wanting help with allergies and depression. Now, the interesting thing with allergies and depression is both can have many physiological root causes, and often those causes overlap. She has what we consider to be lymphatic eyes, right? So she's got that blue base, but she's got a lot of other colors in her eyes. She's got some orange, she's got some yellows, she's got lots of rust brown freckles. She also has a yellowish blob sitting in the lateral side of each of her irises. So we've got the iris go out to the lateral sides and you see a yellowish blob. It kind of looks like chicken fat. And Caroline, that's so good. I love that you love seeing how the connections are done. So good. Well, this yellowish blob that looks like chicken fat is called a pinguecula. That's a proper ophthalmological term, pinguecula. It suggests that she's had issues processing her protein, fat, and calcium for some time, and that often that is a liver-based issue, especially when we see it being this yellow. We know it's really high in fat, and that really adds to the liver story. Now, a pinguecula will not dissolve. It's not going to dissipate, can be surgically removed, but they often do grow back. Interesting that these eyes with all of these brown freckles also show a predisposition towards a strong risk of liver imbalances, right? Traditional Chinese medicine says that depression comes from the liver. And we know if the liver's not happy, we're going to see more allergies as well. So we've got iris markers and sclera markers pointing to the liver. We're going to probably suggest some liver work here, maybe some diet, some herbs, some lifestyle. Maybe if you've got some training to do emotional work, you could work with her on that as well. I don't have a lot of training. I have some training in that area, but certainly if someone comes in with a diagnosis of depression, I can support them nutritionally, but I still want them working with a professional counselor on that. So I would probably do a bit of each of those different things. Leafy greens, that might be my first dietary recommendation, is get a good serving of leafy greens in every day. Let's support the liver. Let's get those methylated B vitamins into you in the form of your leafy greens. I might make a herbal suggestion. I might recommend a liver formula from my favorite herb company, which is Nature Sunshine Products. She's very physically active. She's a personal trainer and she's very competitive in triathlon. So I might encourage her to make sure she gets enough rest. Sometimes these young personal trainers think they're invincible and they should be able to go forever on a dime's worth of gas. Dime's worth of gas would not get you anywhere in this day and age. But, maybe she's not fueling well enough. Maybe she's not resting well enough. And for her emotional health, I might add an aromatherapy formula or a flower essence formula. And I would absolutely suggest that she seek some professional counseling as well. And then I would do things, as I would meet with this client, I would find out if she's willing to share with me, and hopefully she is, what is she doing with her counselor? and how can I best support those efforts so that I'm not contradicting what her counselor is saying, and we've got that unified front. So the iris and the sclera work together to help us understand what the imbalance is and how to work with it. Now, this takes training, practice, feedback, and mentoring to get to where you can do this at a clinical level. And that's exactly why I teach it that way in the Dynamic Iridology Assessment System course. Let's look at another type of scleromarking. This one is called the encapsulation. When we see a blood vessel in the sclera that is hooking around and it looks like a fish hook or a candy cane, and that hook end is always closer to the iris than the stem of the hook or the candy cane is, that's an encapsulation. Now, that fish hook can either be open, so it's actually like a fish hook, or that hook end can loop all the way around to where it touches the stem and close it off. And that is obviously going to be a complete encapsulation. Now, each of these configurations gives us slightly different information. The information that is the same between both the partial and the complete encapsulation is this. There's a history of an infection that has not been completely resolved. And the body is trying to or has sequestered that infection off in an area all by itself in the hopes of protecting the rest of the body from exposure. So this could be something as obvious as a swollen gland, a cyst, or an abscess. It could also be an infection from a long time ago that just has not been fully resolved and it's lingering at a very subclinical state. The client might feel like something's not quite right, but nothing comes back on lab tests, and the doctors are saying it's all in your head. Go get more sleep, go get, take more vitamin C or whatever. And so we just need to be aware that when we've got these encapsulations, they can be very small or very large. They could be very obvious or really hard to find in the body, but they're always an indication that there's been an infection that has not been completely resolved. If it's been completely resolved, the fish hook goes away. That encapsulation goes away. So if we look at the image on the right-hand side of your screen, you'll see this little teeny loop at the end of this blood vessel that is pointing straight up towards the kidney. So this would beg questions. Is there a history of a kidney infection? If there is, when was it? How was it treated? How have you felt since then? So we can use that marking to ask very specific questions. And, if the person says, well, I don't remember, maybe the kidney infection was actually when they were 3 years old and they wouldn't remember. Maybe mom's never mentioned it since then. So when we see these, we need to ask questions about health history to understand what's going on. Only then can we make appropriate recommendations. And we never, ever diagnose. Like, I would never say to someone who has one of these, you have an infection. I would always say, it looks like there's a history of an infection. Right? Do you see the difference? One is saying you've got the problem now, the other is saying there's been a problem. And then we can say, this looks like your body kind of packaged it up and tucked it away as its way of resolving it. And so again, I'm not saying still sick, I'm saying that there might be something out of balance still. So we always choose our words very, very carefully. Depending on what your training is, if you can requisition lab tests, you might be able to requisition the right kinds of lab tests to get the answers you need. Or you might need to ask your client to go back to their medical doctor to ask for certain tests as well. Depending on who the doctor is and how they are, they may or may not be willing to do that. Where I live, some doctors are really good about it. Some doctors are absolutely, I will not give you a test you ask for because you're not a doctor. And especially if someone who's not a doctor, like a herbalist or nutrition coach, said you should get this test, I will absolutely not do it then. They can get pretty turf oriented, right? And so we have to be careful how we ask for these. So can you see then how understanding the marking fully, knowing what its placement is, and then asking the right questions can help us to figure out how to approach the problem? If you can see that, give me an I understand in the comments box. Do you understand how all of these things can work together to help us really get to the root of things? So good, so good. And the beautiful thing here is then once we've sorted through the I, we can go back to whatever your core training is and talk about what do you know? What do you know about kidney infections? What would you normally see for symptoms? What are some things that you would recommend for a kidney infection? And it's going to be different if it's an open fish hook pointing to a kidney infection, and this one is not, or a closed fish hook pointing to a kidney infection, right? The open one says the body is still trying to work on this. It's still trying to release the toxins at a rate that's not going to kill the person. Down here, we're looking at this is already sequestered off. It's going to be harder to find. So Caroline is asking in regards to blood work, what would we be looking for? That's a good question. You might be looking for something as simple as a wonky white blood cell, right? So you're looking for the immune factors, some of the other immune factors in the blood. That would be probably my first place to start. I tend to do a little bit of work with the emotional meanings behind things as well. So I would want to delve a bit into the emotions to see if a part of this problem was emotional. And if there was, and so this is emotion different from depression, because that's a very clinical thing. So I'm looking for other kinds of emotions that might reflect a higher risk of kidney problems. And if we can figure out what those are, then sometimes getting to the root of those helps us unlock the physical side. So now that I've been nattering on for just over a half an hour, I just wanted to introduce myself because I think I'm fairly new to some of you. And again, it's so good to meet you. Thank you for being here. My name is Judith Cobb. I am one of 8 level 3 certified iridology instructors through the IPA organization in the world. We have to update our credentials every 2 years. And so you can see my last couple of updates here, but I've been a certified iridologist for decades. And I've taught many courses. I've worked with hundreds upon hundreds of clients. I've written many books, most of which are out of print. And the only one that's still available is the textbook for my iridology program, which for dynamic iridology. And that textbook is available to my students. I'm also a master herbalist and a natural nutrition clinical practitioner, and I have affiliations with these 3 organizations as well. And what I love about these organizations, all of them, including IPA, is you have to produce proof that you know enough to actually join the organization. And then you have to do your continuing education constantly for all of these organizations. So it means that I've always got my nose in a book. I'm always attending a class. I'm always trying to stay up on what is the latest information so that I can teach and practitioner from a stronger perspective. And it's important that we all have that anatomy and physiology and whatever other tools you have that you want to integrate with iridology, we can help you build a really strong package, a clinical package with that. Another case, this is a 79-year-old gentleman. Sophia says, does a closed fish indicate encapsulation of the infection? Yes, it does. So this is Nick. Nick is 79 years old. I love working with Nick. He's the kind of guy that we can poke each other back and forth. We spend more time in his sessions laughing than working, I think. It's just so much fun. I really appreciate him as a client in so many ways. So he came to me because he was overweight and his weight problems were aggravating his knees. It was making it difficult to walk. And he loves going on cruises. And, when he gets to these exotic places, he loves to get off the ship and just go walking and learn everything he can about that part of the world. This is all complicated by the fact that before he came to see me, he had prostate cancer that was treated with radiation and hormones. And so he was on estrogen therapy to help keep the prostate in check. And estrogen, as you know, makes you gain weight. In addition to that, in his health history, his doctor had diagnosed him with congestive heart failure, irregular heartbeat, shortness of breath, and reflux with heartburn. He was on 8 different medications, including an anti-anxiety medication to help him stay relaxed when his breathing gets labored. With the irregular heartbeat, shortness of breath, and the reflux, those are also symptoms of a hiatal hernia. But his doctor hadn't diagnosed him as that, and I certainly can't. I have an assessment that I can do where I can go, well, that looks like you might have a hiatal hernia, but I can't tell you you do or don't. So I sent him to an osteopath to get him assessed. But I also wanted to know, in looking at his beautiful blue eyes, these are just gorgeous blue eyes. I wanted to know about his blood sugar status. What was his hemoglobin A1C? Was he insulin resistant? I wanted to know if he also had any tests done to test his uric acid level in his blood, because he's got some suggestions here that say he's prone to that. He's also got gray patches. We've seen those before. And again, we don't have time to delve into everything today, but he's got the gray patches, and that is a worrisome sign to me. Notice he's also got a little pinguecula here and another one starting here. Okay, so he's got pinguecula showing up. So that is probably about liver, right? And notice too that at the ends of these blood vessels, this is a little hard to see. So I want to see in a comments box, do you see this? Can you see that at the end of this blood vessel, there's a little bit of a sort of a blue dot and a tiny haze around it as well. Little teeny bit of a blue dot. This one's very, very faint. This one's pretty faint. This is a little more obvious. And so these little bits are telling us that he doesn't handle his carbohydrates well. So Sophia, yes, you're seeing what the Jensenians would call a lymphatic rosary. In constitutional, we would call it the hydrogenoid subtype. And so Martha says she can see the blue dots. Fantastic. This is so good. That's a hard sign to see because it's very, very small. We also have in here that thing that we saw in the other eye where we were going to ask about blood lipids, so cholesterol, triglycerides, and again, blood sugars. Notice that we've got this bright pigment right here, which is telling us liver wants to be a little cranky. We've got another little pigment right in here, a little bit of an orangey color to it. That's telling us that pancreas wants to be cranky as well, maybe liver as well. We've got a little bit of dirty yellow throughout the eye, which tells us that he's probably a little bit prone to building up uric acid. Now, he did bring in labs. He really loved bringing in labs because I go through every lab. And if there's anything out of balance, I explain to my client what it is. And he brought in like this stack of papers with all of his labs that he had just had done. And he said, I don't know what any of this means. And my doctor didn't explain it. And I said, well, that's okay, because that's why you've got me, right? You've got me. I'm in your corner here. So we were able to go through this and go through things one at a time and say, well, your red blood cells are great. This is great. This is great. Your hemoglobin A1C is way too high. That means that your doctor probably should have said that you're type 2 diabetic. I'm not saying you are, but we need that to be lower than 5.7. At 5.9, you're pre-diabetic. When you're up here, you are type 2 diabetic. So you need to go to your doctor and talk about this. But I'm going to work on it with you too, because I know what the doctor's going to do. He's going to give you metformin or glucophage or Giardians or something like that. I want to work with it with diet and lifestyle because I know that you can get this under control without drugs if you work at it. His leukocytes were low, so that suggests fighting an infection. His lymphocytes were very low normal. Is this all fallout still from the chemotherapy, from his prostate cancer? Could be. His hematocrit was very low. His erythrocytes were low. His testosterone, of course, was very low because they wanted to keep it low. And his triglycerides were elevated, like they were sky high as well. So in his initial visit, as we're looking at this and we're seeing he doesn't handle his carbohydrates well, and probably hasn't for a long time. And that's what's throwing his cholesterol and triglycerides and things like that out of balance. That tells me volumes here. about what I can do to help him. Because if I can help to get his sugars balanced, we can then take down the inflammation. And if we take down the inflammation, we can start taking down the weight. And if we can start taking down the weight, we can make his knees more comfortable and we can help him start to walk more. Does that make sense? Is that the pathway you would want to take this client? If it is, give me pathway in the chat box. That you can see the dominoes, how what you're doing here is going to take you over to there, right? And we have to get each of those steps happening in the right order. We could give him something just for blood sugars, but if we don't fix the diet, we're just band-aiding. If we can get him to fix his diet, then we can get domino effects all the way around. Giving him berberine for the blood sugars and just doing that. Well, we haven't done anything to address uric acid, right? We haven't done anything that's going to correct the cholesterol. We just haven't done anything, really. We've done one thing, and it's not enough. So I gave him some little exercises to do in case he had a hiatal hernia, just little things. They're not going to hurt anything, but if he has a hiatal hernia, it will help until he can see the osteopath. I did give him berberine IR for the suspected insulin resistance, because that hemoglobin A1C pretty much says insulin resistant, right? I gave him some glucosamine, a glucosamine blend for his joints and for his gut health. Did you know that glucosamine and chondroitin are good for gut health? And we gave him some omega-3. We needed to get that in there to make sure his blood stayed nice and slippery and loose and didn't get too clumped up. His diet was not great. He was eating low cal, but he was eating high carb, and he had mistakenly cut out fats. So instead of having a piece of white toast with marmalade on it for breakfast, or a rice cake with marmalade, that was his favorite thing, we got him to switch to veggies and eggs for breakfast. I got the funniest email from him. At first when I said, he likes cooking, so just chop up some veggies and saute them while you're, steaming some eggs or boiling some eggs or poaching some eggs, and a couple of eggs with a nice plate of these veggies for breakfast. He looked at me in his lovely English accent, and I can't mimic his accent at all, but it was like, you want me to eat vegetables for breakfast? Are you insane? And I laughed. I said, just try it. Try it as an experiment. Try it for a week or two. Let me know how it goes. And after about 4 or 5 days, I got this cutest email from him saying, if anyone had told me I would actually enjoy vegetables for breakfast, I would have told them they were insane. Oh yeah, I did, didn't I? I actually like it though. And so it was so fun. And we got him to add even more vegetables throughout his day as stir fries or as leafy green salads, and encouraged him to chew them really well. And we got him to start walking 30 minutes a day. At first, he could only walk 5 minutes at a time because his knees would hurt so desperately badly. But he did it. He would go out for 6 5-minute walks every day. And I kept thinking, oh, I love you. You are such an amazing client to do that, to figure out I can do 30 minutes, just not all at once. And I'd already told him he could break it up. But the fact that he did it was just gold stars all the way around. I suggested sleeping on a wedge pillow so that if he had a hiatal hernia with reflux, it would settle that down. Now, reflux can really make the breathing feel weird. He sent me another email. He said, that wedge pillow, why didn't the doctor suggest that to me? He said, I have not slept through the night in years because of this, but with that wedge pillow, I'm sleeping peacefully every night all the way through with no disruptions. Fantastic. As we worked together, he started losing weight. And as he started losing weight, he'd come in and he'd say, see this belt? I had to poke new holes in it. Or see these pants? I haven't worn them in 7 years. This is the first time I've been able to get back into them. He's really just so adorable. And he just kept making improvements and sticking with it and doing well. He went on a cruise and he likes to drink wine on the cruises. And I said, so do it as an experiment. You know how fabulous you feel now, and you're not drinking alcohol at all right now. We've got you off coffee. You've done such good work. So do it as an experiment. You're on a 10-day cruise. The first 5 days, have a glass or two of wine every day. See how you feel, and then stop drinking wine for the next 5 days and see how you feel. And if you notice a difference, which way do you want to feel? What feels better? right? And, he wants to have a glass of wine every day. I'm not going to argue with that because he's doing so many other things that are really good, really good. So again, when we're talking about iridology and sclerology, some health professionals want to learn it just because they do. And that's fabulous. It's such an interesting science to learn and to be able to apply. But after they learn it, they find out that it can help them in so many other ways. It can do things like help them do their assessments more quickly and more accurately, right? It can help you to develop better and faster rapport with your clients because now you're asking questions that are client specific rather than going through a checklist of questions or giving them a 5-page questionnaire. I've had some people tell me that they give their clients a 20-page questionnaire. I'd be like, nope, you're not the practitioner for me. I want to have a conversation with you. Like if I go somewhere and they give me a questionnaire that long, I won't fill it in. I will say to their face, I want to talk to you. I'm not going to fill all this out. Most of this is irrelevant. I want to talk with you. Okay. And that's just how I am. And iridology, when you do it well, eliminates the need for an intake form. It does not eliminate the need for an informed consent form. You still need that. Absolutely. But the intake questionnaires, you can turf those. I haven't given my clients an intake questionnaire in years. I have one, and as we're chatting, I will fill in the relevant bits and pieces that I want to know about them. And I'll make pages of notes elsewhere for them or for my own records as well. But I don't give my clients that. And so being able to understand your client on a deep level so that you can create a program for them on the spot is what I teach in dynamic iridology. This is about being able to see genetic predispositions in the irides and to triangulate that with the sclera so that you can laser in on what needs to be done and why it needs to be done. It gives you perspective that allows you to create programs that are doable and not overwhelming for the client. That is so important that we keep our programs really in that range of possibility rather than in that, oh my goodness, I have to take how many supplements and, I have to do all these things. How am I going to fit this in? The fact is that a lot of health coaches spend way too much time creating intricately detailed, difficult to follow programs. And those programs discourage their clients. Their clients don't stick to them well, don't come back for follow-ups. That's not good for your business. Most iridology programs only teach the markings. They teach the nuts and bolts, but they don't teach you how to build the thing. Like, here's all the pieces you need to build a car. Good luck, right? And that's a problem because in doing that, you don't learn the nuances. It doesn't teach you how to integrate what you already know about how the body works and what you already know about the different modalities you use. And I know a lot of teachers will say at the end of a course, yep, you'll figure out how to use it. I personally think that's wrong. I do. I really think that's wrong. Do you agree with me? When you have a teacher, would you like to be guided in learning the process of how to think through and put all the pieces together and how to apply it? You do? Sophia says yes. Or would you rather muddle through by yourself? You've got all the pieces figured out now. Yeah. Carol Ann says, love your method. Thank you, Carol Ann. It's exactly what I teach. And actually, we've got Kathy is here with us. She's one of my course grads. Go, Kathy. And she can attest to the fact that this is how I teach in class as well. So a lot of teachers don't include practicing on cases or giving you feedback or mentoring you. They actually, if you want that, you have to pay extra for it. And so the end result is when you do it the way I teach it, you stick with it. Kathy says, LOL, this is great. Thanks, Kathy. Sophia says, I learned iridology years ago and stopped using it because I felt lost. I hear that from a lot of people who enroll in my course, Sophia. In fact, this is interesting. Karen Choate is one of my course grads. She's a certified iridologist with IPA now. She has been for many years. I just returned from a regenerative detox course where iridology is implemented. Most people I talked with did not have anywhere near the same experience with their iridology education. No support, unanswered questions, and a lot of confusion. Mostly they finished their classes not knowing how to implement what they had learned. I feel so absolutely blessed as to have been taught by you. I feel totally supported even still as I've graduated, I think it's about 5 or 6 years ago now. I don't think there's anyone out there practicing, educating, and teaching iridology like you. Fantastic. Love that. Love that. She's a CNHP. She specializes in gut health. And Kimberly Zadalis has a master's degree in radiology and a lot of other things. She said, if you're wondering which iridology course to take, you can stop looking. You found it. Judith Cobb is an excellent instructor with many years of experience. She is a caring and compassionate person who is dedicated to the field of iridology and her students. I personally practice both Eastern and Western philosophy medicine and was very impressed with the layout of her program. She makes it easy for her students to balance life, work, and study. Love that too. So, quick introduction to the course. Dynamic Iridology Assessment System for Health Professionals is the only live, online, fully mentored course for anyone who's got a college-level anatomy and physiology course already under their belt, and they're working with clients and they want to streamline the work they're doing. They want to be able to stop working overtime creating client programs, stop overwhelming their clients with programs that are just not doable. They want to be able to create programs that will increase client compliance and client success and long-term retention. That's exactly what we focus on in this program. By the end of the program, I have you doing iris assessments in 10 to 15 minutes complete with program creation, appropriate for that client at that stage of their development. So again, the only prerequisite is you have to have a college level anatomy and physiology course with a grade over 80%. And a part of that is because it makes it so much easier for me to teach you connections in the eye. But the other part of it is it's required by IPA should you decide you want to sit for the certification exam. So I make sure my students have that before they enroll in my course, so that when they're done my course and we finish the mentoring, they are ready to roll with the final exam. There's a lot of teachers who don't require the anatomy and physiology. I didn't used to, and I will tell you, the course is overwhelming if you don't have it. I had a lot of students drop out because they didn't understand what we were doing. They thought they understood the body, but they didn't. They didn't understand it at the level we needed at, and they dropped out. And as much as I tried to nurture them, I cannot teach them A&P. I don't have that kind of time. Right? That was their responsibility to bring that in, and they didn't have it. So if you, let's get this clicking here. If you've already got A&P, if you want to learn iridology and sclerology at a professional level, if you want to learn how the markers play off each other, how do they work together? How does that build your client's story? If you want to learn what questions to ask, you've got the symptoms, you see this in their eyes, you see this with their pupil, you see this with their sclera. How does that all work together? What questions do you now need to ask to drill down and get the information you need? If you want to learn how to create programs your clients can be more successful in implementing, so important. If you want to be mentored for the long term, and I'm speaking years, not just when you're enrolled in the program. I don't know if you're like me, I've taken a ton of courses, and the last day of class, that door slams shut and you have no more contact with the teacher. You might have a million questions a year from now, and you're left to your own devices. I don't do that to my students. We have a platform where my students can continue to engage with me. And I don't care if they're certified, if they're not graduated, I hope they're all graduated. But it's a platform where in our community where there's ongoing support for as long as I'm going to be teaching for, and I'm not planning on quitting soon. If you want to know, and then if you want to know what's included in the course so you can make an informed decision, talk to me. Take this URL, tinyurl.com/dynamic-iridology, and use it to, let me just put this in here, use it to schedule a time for us to talk about the course, to talk about your goals, to talk about what you want to accomplish. Let's see if the course is a good fit for you. If it's a good fit, I'll invite you to enroll. If it's not a good fit, I'll give you some coaching in another direction. I mean, I've been in this industry for over 4 decades, and I'm very happy to coach you in a way that will be more useful for you. But if it is iridology, I will invite you to enroll on the spot so that you can start with our next group that is starting on April 11th. So again, if you are ready to talk about it, reach out to me. And Sophia, this course would likely be, if you've got anatomy and physiology under your belt, this course would likely be a heaven sent for you, right? It's going to take what you know and might undo some of it because some of it might be outdated, but it will teach you the skills you need. And we work on helping you build the confidence you need to use this effectively in your practice in a way where it's not going to add time to your client sessions. It's actually going to save you time in your client sessions. So if that sounds like interesting for any of you, please go ahead and grab that URL. Let's set up a time to have a chat. Let's see if this is a good fit. Now, any other questions about, you're welcome, Martha, any questions about anything we've talked about today? Or are we all good? So good to have you with me today. Nice to see you. All right. So again, if you're watching this on replay and you've made it to the end, remember to drop a like, a comment, share the video, subscribe to the channel. And otherwise, I hope to be speaking with many of you very soon. And we will hopefully see you next week again. Sophia, good question. Very quickly, the course is 20 weeks long. And then there is the mentorship to prepare you for certification. Okay, so we meet once a week for about 2.25 to 2.5 hours in a small group setting in a webinar just like this, only your cameras are on, and 20 weeks to do the training. So we get really deep, we get really meaty, but we're really looking at creating a solid learning experience for you. All right. So with that, my friends, I must go and get ready for my next client. Have a marvelous day, and we will talk to you very soon. Bye for now.